Hello, this is Resilience Radio. This episode is with Sharon Wheeler on structural integration and scar work. I'm Irvin Eisenberg, host of the show and owner of Resilience Occupational Therapy. As always, the opinions on this show are not necessarily shared by me. I like to feature a variety of different perspectives, and everyone has different needs. It's also not meant to be diagnostic or prescriptive in any way. In any case, today's guest is Sharon Wheeler. She's been a Rolfer for 51 years, starting her training directly under Dr. Ida Rolf. Sharon maintains a practice in Rolfing structural integration and Rolf movement in Port Orchard, Washington. Sharon teaches continued education workshops on scar work, bone work, cranial work, and the art of structural integration. It's really great to have you here today.
Well, thank you. Thank you, Irvin.
I was wondering if you could start off talking a little bit about how you came to scar work.
It was more of an accident than anything else, really. I came across a woman that needed some help in a knee joint, and she'd had 5 surgeries through that knee joint, and I couldn't get any help for her. With all my structural integration techniques, I couldn't seem to get anything. And I thought that perhaps if I could soften that tissue up a little bit, I might be able to get some help for her. So I just started letting my hands do whatever they wanted to do. And I wasn't even paying attention to what I was doing. And when I stopped to check my work, about 15 minutes of it, I was amazed to find these changes that I had done, and without really realizing it. I wasn't really watching what I was doing. Probably if I'd been watching what I was doing, it wouldn't have happened. So, yeah, because it's such light work. I mean, I'm a structural integration practitioner. People like us like to go down into the body and work out deep problems and damage and stuff. And that's what we do. And I was not expecting that this light, little, delicate almost work would accomplish anything. And yet it does. So, as I say, if I'd been watching, I probably would never have come up with it.
Did you have a chance to show this work to Ida Rolf?
No, no. She told me her approach to scars was to ignore them and to establish the function. And a lot of times that does work. It does. But when the scar is to the point of where it inhibits the range of motion and it causes problems, then you have to deal with the scar. So you have to find a way through the scar tissue itself. And the way that my hands found, not my brain, but my hands found, was a little piece at a time. It's an accumulation of many little changes, each change almost so small that you don't see or feel it. So if you do 3 of these, you don't see very much. It's 3 little motions. Say you do 3 things, 3 little things on the body. You wouldn't feel very much in terms of difference. But if you do 20 of them, you do feel it. So it's interesting. So it's a question of taking little tiny, almost imperceptible pieces and adding them up. That's what seems to work with scars. And it's very nice because it doesn't hurt. It's usually easy to put up with and very fast work for all its little piece at a time. It adds up quickly.
So there's a lot of different practitioners out there that talk about working with scars. How does your work differ from other things that are out there?
I'm assembling things. I'm putting things together. I am rematching layers. I'm pushing things at each other. I'm not trying to tear the tissue apart. I'm reassembling. That's the single most different thing about my work and other people's work. And
I've
also, one of the guidelines for our work is to do your very best to work with as little discomfort as possible. None is preferable.
So it seems very different, and I have personal experience with, I do the scar work, and I've been to your trainings, and it's very different in that quality than other structural integration trainings I've been to, where we're still trying to be subtle and get things not inflict pain, but sometimes pain happens along the way, and we don't necessarily fear that.
Yeah.
Um, how have you found teaching this work to structural integrators that are used to getting in there and fixing things?
Well, it's a bit of a surprise to them that you can accomplish anything with light work. So that's a bit of an interesting moment when they realize that, oh, I really am going that light, and they try it and it works, so they use it. So it's a useful thing to have. Um, Not everyone has these big obvious scars, but a great number of the population does have scars, you know, from damage from accidents and injuries, but also surgical scars where you need to have help from the medical profession. So all of these different kinds of scars tend to leave residual shortening and loss of function, loss of range of motion, loss of sensation, loss of integrity in the tissue, loss of fluid flow, loss of all kinds of things. And it seems that if you reassemble the tissue, the function comes back for the most part.
Hmm.
Interesting.
So you've talked in some workshops that I've been to about sort of some of the theories of scars and tissue healing and how fast this work seems to be and how it doesn't seem to line up with the consensus science of the day or of the previous day. Science can sometimes practice can sometimes take a while to catch up with science. But what do you feel like's happening when you're doing this work?
What I'm doing is I'm trying to make the tissue smooth. That's my goal. Okay. And that simplifies things for me. Yeah. So when I find an area that one of the outstanding features of scar tissue is that it's uneven. And by that, I mean, there's some areas that are hard and some areas that feel like they're missing something. So there's all kinds of strings and hollows and lumps and strange feeling things in scar tissue. Okay. Normal, regular tissue has a certain push and give, and it's kind of similar on a lot of parts of the body, that resilience of the normal tissue. But scar tissue has lost that to a great extent. And what I was trying to do was get some resilience into it because I find that resilience in tissue overall in the body from structural integration is a very good thing to have for function. So I thought that the scar might benefit from a little bit of softening up, resilience, right? Some give in the tissue. So by doing that, by giving the tissue, it turns out that all these other things happen. But my viewpoint is I'm making it smooth. And all of these other things that happen, which are delightful. I mean, sensory nerves returning, range of motion returning, cessation of discomfort, all kinds of interesting, in a sense, side effects. Because if you'd asked me to make that nerve function, I probably would just throw up my hands and go, I have no idea. But when I make the tissue smooth and feel like the rest of the body smooth, then that area starts to function like the rest of the body. So, but how it does it and why it does it is something for science to figure out. And we have some people working on the job a little bit. We're starting in the science. We need to do that. We have a wonderful researcher, Beverly de Valois. She's from the UK. And formerly she was researching acupuncture and has gotten a wonderful reputation. Beverly, we're lucky to have Beverly. We're lucky to have her. And so we've raised money. We decided we were going to have a party. People wanted a party, and I said, yes, let's have a party. So we had a party in the UK, and it was a day. And the money from the party that was left over after we paid the venue and everything went to research. And we got $10,000 for Beverly. And that's a nice piece of money for her to start with. And we're going to be doing another gathering, I hope, this coming September in 2021 in the UK for Scarwork teachers and students and, but us, not the general public, just us. We're going to have a party. So it'll be fun. And we'll do the same thing. If there's money left over, it'll go towards research. And Beverly will help us, we need to find a home. We need to find a university or somebody like that to adopt us and, let us do some research on why we get such results. What possibly we might be able to find out some of that, maybe. Be interesting.
So how have different professions that you've tried to teach this work to? I know you've taught to not just structural integrators,
Yeah.
responded to these
Well,
techniques.
I've had a massive prejudice for years that only structural integration people could understand this stuff because it grew out of structural integration. I consider this scar work to be a little twig on the tree of structural integration. It's a sort of a little interesting piece. So, oh, I'm sorry. What did you ask me again?
How have different
Lost my way.
professions
Where did
observe,
it-
responded to the work?
Most of them are enchanted with it. It's an interesting work, you know, very interesting. And you can get, all kinds of cosmetic results, which makes people happy. It's not why I do it. I do it for functional results, but the cosmetic results, we'll take them. We'll take them. It's okay. It can look better too. But it does all kinds of interesting things. And as I say, it's very interesting that way. But I had a huge prejudice that only, structural integration people could understand, right? And then I got talked into letting this young lady into a workshop. She was an esthetician. And oh boy, she was good. She was really good. She had a way with those hands of hers. She just loved this work and just was very, very good at it very, very quickly. So after that, I decided I would take a chance and open the trainings to more than structural integration people to see what would happen, because we had such good results with the first person that was not structural integrator. And I've done that with the I've done that with scar work, and I've done that with bone work. Both of those particular disciplines I've opened up to other people.
Yeah. The scar work, do you the sonograms and such for the scar work? You've had some promising.
Yes, we have. We've had some good ones. We've had some good stuff. I presented 3 sonograms at the conference, the Fascia Research Congress in 2015 in Washington, D.C., that were an hour's work only, before and after sonograms. And the before and after sonograms, the longest we went, I think, was 6 weeks. And that was because the lady developed a cold or something and missed appointments. But a lot of the timeline before and after are quite close, within a week or two. So they turned out very interesting. I don't read sonograms. The doctor that did them told me this information. She said that for the most part, the distance between the scar and the surface of the skin increased by, the first one was almost half an inch, and the second one was a little over a half an inch, I believe, in terms of the change that happened within the thing. Because when you have a sonogram, you can see the different lines are different densities. The more dense it is, the whiter it shows. So you can see, this is why you can see babies' features and things. So you can see the scar features. It's not a baby, so you don't recognize it, but it is something. It's a density, right? It's a density that you can see. So you can see these. And after you work with the scar tissue work, the distance between the surface of the skin and the scar has released a great deal. And when you look from the side on these abdominal scars, there were 3 abdominal scars we did, you can see all of the abdominal fascial layers starting to come back in. She showed me, for example, the ones that are kind of almost mystical, Scarpa's and Camper's fascia. She showed me those that I had actually replaced those. She said that was very, very unusual, because when you have a cesarean section or you have an abdominal surgery, you lose that integrity. And then that came back in these 3 women. And the third one was very interesting. By then the doctor was beginning to wonder that if I did this kind of work to scar tissue, what was I doing to normal tissue? In other words, should I be confined, right? Whoa. So she took a little a picture of a corner of the abdomen area that she didn't have scars from what she could tell, right? It was fairly clear. So she took that before and after on the last person I did, and there was hardly any change in the normal area. There was only change in the scar tissue area. And this last one had been an ectopic pregnancy that had ruptured and left a great big, almost like a check mark. It looked like it was quite large. I think it was adhering it the probably the fallopian tubes and who knows what else in that area from the adhesion. Probably adhered it over to the pelvis. Caused a big, big, very large adhesion. Those pictures show the adhesion is gone. You can't see it from any angle. And she took many different angles because she couldn't believe it was gone. She was looking for it. She couldn't find it anywhere. So it looks like you can disappear big scars and you can make it so that they function. People function again. There was no more pulling, no more pain, no more things. This is why these women were coming, because they were uncomfortable. And the scars were old scars, 40 years old and stuff. They weren't like, 2 weeks ago or something, or 2 months ago. So all this old scars, which people don't think you can do anything with old scars. And it turns out they're actually for scar work. So that's our best thing. We're really good with old scars. We're good with newer ones too, but we're really good with old ones. So that's another thing that we're different in is it's we've discovered in the fascia research people, I think, have got a pretty good case for if you work with scar tissue right after surgery within 10 days, you can get a change. But they don't think you can change it after that. So I don't work with things that are so new. I work with, old scars. Stuff that's been there a while.
So the quality of the work itself is very light.
Yeah.
And are you familiar much with lymphatic techniques? And how is how does it compare?
Uh, I'm a little bit familiar with lymphatic techniques, but I'm no expert and I've never taken classes, but I've seen some of my students who've shown me different things. And from what I understand, they're trying to open channels in the tissue for the lymphatics to flow. And I'm not doing that. As I say, I'm making it all smooth. So it's not the same kind of endeavor to try to make something, um, if that's what they're doing. My apologies because I don't know what they're doing. So let's not take that as that's what they're doing because we don't really know. But it's that's what I understand that they do a lot of. But what we're doing is changing the quality of the tissue. So in a sense, if you had a surgery and the scar formed in almost like a dam across an area, you would get swelling, possibly swelling lymphedema in limbs and things after breast surgery. Lots of women have lymphedema in an arm that's involved on that side. And it's a big swelling, it makes the arm very heavy, it's uncomfortable and not a wonderful thing for ladies. Anyway, it's possible, I think, if it's because there's a blockage from the scar, if you get rid of the scar, it seems to be that the lymph does flow better, which is a good thing. Maybe not perfect, but a lot better. And better is a very good thing in some cases. Now, the interesting thing about the scar work, and another thing, because I'd love to be doing some long term research on it, is that after one does the work for an hour or say an hour's worth of work or maybe a little more because I like to try to get as much done as I can, maybe I'll do an hour and a half, right? So you do a lot of work at one time and then the person goes away for weeks, sometimes a month or two, okay? And when you see them when they return, that scar is not at all where you left it. It's improved a great deal. Another mystery of the scar work. I have no idea why this rapid healing should set in after you do scar work to an area. It doesn't make sense, but it's the same sort of level of speed of healing that you get right after you get damage, where there's a tremendous output of energy and tissues and blood flowing and things being done in an area to repair that area. That's the kind of level of transformation that happens in between sessions, which was a surprise to me. And is indeed one of the reasons that I am teaching because of that long term effect. So you can get a session of scar work and then you can let that person go for a month. And a lot of the work you were planning on doing won't be there for you to do when they get back. You know, it'll resolve itself, which is we'll take that too. I mean, that's a good thing. So that's wonderful.
So are there certain situations, be it the person's relationship to their scar or the type of scar, that make someone more likely to have a positive response or less likely?
I don't know. I don't think so. One of the things is about people's relationships to their scars is they generally don't like them very much.
No.
They're not fond of them. They may make them the center of a tattoo as a joke, but they're not really happy. So if you can help them with that, that gives them a piece of themselves back. And that's the single most uh, expressed emotion is like that they got a piece of themselves back, right? It feels like them again. They say it feels like me again. And you hear that over and over again when you work with people.
Mm,
That's a wonderful thing.
in the most literal sense, that's structural integration, isn't it?
Yeah, it is. Yeah, it's a little corner of it, as I say. I really, I never would have found this without Dr. Rolf training me the way she did. She taught me to have to sense with my senses. I didn't have an anatomy book I could rely on. I was forbidden anatomy. Wow, that was tough. And so I had to learn to feel and see, you know, rather than assuming, and having maps and getting that part of my brain involved in it.
Now that's unique to you, that relationship with Ida Rolf, is my understanding.
Probably. I'm not really sure if there's anybody else that she did this with. I was an artistic experiment, is what she said, which I can understand. Now that I'm teaching, I can go, oh, yeah, I can understand why she'd try that, to see how it would come out, you know?
Do you get a sense as to how she felt about the results of her experiment?
She was very happy with me. She was. She
I'm not surprised.
was. Well, I'm very glad she was. She wasn't happy with everybody, but, you know, she was very kind to me.
So I was wondering if you had any closing thoughts on things that you wish everyone understood better about their scars.
Scars in particular are misunderstood. People consider them almost to be an alien intrusion into their lives, and they want to get rid of them. And people are mad about the whole business. It's disfiguring. They're assuming that people judge them for the scars, so they don't like them. From my point of view, a scar is a treasure trove of good stuff just waiting to be reassembled into the real thing. And it's conveniently located near where you need to do your work. You don't have to go someplace and get it. It's right there, right? So you have the materials you need for reconstruction sitting right there. All you need is the willing hands to do it. That's all you need. So for me, scars are a wonderland of good things, which sounds really strange, I suppose. People don't like them, but me, I'll kid with people. I say, "Oh, that's a nice one," because why not? I mean, black humor is better than the other kind. So you might as well have a little bit of fun with it. And that's how they kind of feel about the whole business too, after all. So we can kid about it and joke about it a little bit. Usually scar tissue classes are a happy buzz of, joking and carrying on and stuff. Why not? You know? If it does get serious and people do cry about it a little bit, we bring them a tissue and all that. We're not disrespectful. But for the most part, we're having a great time. And most people don't have a lot of emotion. And most of the emotion we get are tears of joy. People can't believe how good they feel in such a short time, and they're very happy. So it's the long-term effects that are the most interesting in some ways. And as I say, hopefully we'll get some real research done. And but we're just starting. We're just starting. So don't be mad about it. I mean, you know, I thought everybody knew how to do this work. I wasn't in any hurry to push it forward. I'm just one person. I didn't think I had a whole lot. I didn't realize I had something interesting until 2007 the first Fascial Research Congress. And I looked up Tom Findley's website. It's How to Do Research, tells you stuff. And the very first thing you do, a search of the literature to find out if there's anybody else doing what you're doing. And I did that in 2007 after the Fascial Research Congress and saw that there wasn't anybody out there for the most part, almost no one doing scar tissue work like I was doing. So I got very serious. I think at that point, from then on until I started going to Europe, I think I've trained probably close to 5,000 people in the US. So it's not like there are not people out there. Most of them are structural integration people. I confess, but there's quite a few good massage people and other people that have come in. I train anybody, just about. Anybody that has license to deal with people. You have to have at least a massage license to put your hands on people, right? So you need that much training. But I'll train doctors, I'll train nurses, I'll train all kinds of people like that, estheticians, sculptors, all kinds of interesting folks.
Well, thank you so much for coming on today. I really appreciate your time and sharing about this fascinating work that I personally love doing.
Well, thank you, Irvin. Thanks for having me on your show. It's a lovely thing you're doing.
So that was Sharon Wheeler, a Rolfer, speaking to us about Scarwork. I hope you enjoyed. If you did, you can subscribe and get a new episode from a healthcare practitioner or researcher every week. You've been listening to Resilience Radio. Take care.